The coronavirus is killing Black Americans at a disproportionate rate.
African Americans make up more than half of Chicago's COVID-19 deaths.
Of nearly 3,300 coronavirus patients who died, found 42% of them were African American.
COVID-19 has infected hundreds of thousands of Americans since February, and a disproportionate number of them are Black people. Originally, the Trump administration promised to get official national numbers out in 2 to 3 days, but that timeline has shifted since.
When will we have that?
I would say within 2 weeks.
Experts say it's not that Black people are more likely to contract the coronavirus, but that existing health disparities have caused more underlying conditions that frankly make COVID-19 hit harder. On one side of my family alone, we have asthma, diabetes, heart disease, and other immunocompromising conditions. All of these can lead to the worst outcome in the COVID-19 pandemic. And the reasons why this is the case go way beyond our current crisis.
The effects that we are seeing in our African American communities are the result of ongoing long-term systemic racism. I'm Darlene Oliver Hightower. I'm the Vice President of Community Health Equity at Rush University Medical Center.
Were you surprised that the COVID-19 hit the Black community in the way that it has?
Not surprised by that at all.
That's because some of the work that Hightower does is about addressing those underlying conditions head on. In recent years, she and other healthcare experts have started to find that one of the possible solutions could be in this field of study that explores the social determinants of health. For years, researchers have found spending more money and time on things like better education, better jobs, affordable housing, and food assistance can help mitigate health issues before you even need to go to the hospital.
Where you live, how you live, all of those things impact your overall health. They impact the health, wellness, and the vitality and vibrancy and quality of your life. So there are definitely historic roots that are based in lack of access to quality education, lack of access to quality jobs, lack of access to quality health care, and then just your neighborhood and physical environment, where you live. That ends up looking like I now have heart disease. I have high blood pressure because I don't have access to healthy food and access to walkable neighborhoods.
We've spent so much time in America fighting about health insurance in this country, but the study of social determinants of health takes a much broader look at what healthcare is about.
If you look at buckets of what's impacting health, 30% is based on your access to health care and even your behaviors. 70% though is in the social factor bucket, education levels, transportation, having a job. So I can have, great insurance, but if I have these other social factors that are impacting my overall health, then it's, I'm going to have some challenges when it comes to my health outcomes.
That's why even after the country flattens the COVID-19 curve, researchers say these disparities for the African American community aren't going anywhere unless we deal with these social determinants of health. But it might be a while. It's a relatively new theory, especially in the political world, but it's sort of catching on. In December of last year, the Social Determinants Accelerator Act was introduced in the Senate and House, but has gone nowhere. And one of the reasons the entire movement hasn't taken off in DC is the money.
It requires a deeper financial investment over a longer period of time before you get the type of outcomes that you're expecting to see from that investment.
But cities like LA, Chicago, and Portland, who have run programs to prove the theory, have seen that the investment pays off. But it takes an almost complete rethink of how we see healthcare. It needs to be a lot more holistic.
A lot of times we want to put organizations and people in a box. Oh, you're a hospital, you can only do X. Oh, you're, in education, you can only do X. But when we're talking about the social determinants of health, we're talking about cross-sector, multi-sector partnerships, everybody kind of coming together to work together to solve a deeply rooted, long-term systemic problem.